Hey, hello, 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 and hello again. Nice to see you here. Nice to know that you are always waiting to see what we have for you today. And today it is about career from a long time friend. We were in the same house. They're just sisters, like I tell you. I always bring them here because, hey, we make a difference. So I've got today, we were in the same 92 set, and she finished from Federal Government Girls College Akure as well, and she's a dentist. She's been practicing for over 2 decades, not 20 decades, over 2 decades. Wow! So she knows her stuff. It's her bread and butter. So she's going to tell us more than we need to know, or everything we need to know. And if you've got questions, please take time to write in the comment down below, and she'll be ready to answer your questions. Thank you to those online. Thank you for coming back to always find out what we have. And thank you for sharing the video. Thank you for commenting. Thank you for liking. Without you, we won't be here. So thank you, and thank you again. Without wasting much time, I will call on the screen Dr. Funmi Sijuwade. Hey, you are welcome.
Hi, Bobby. Hi, everybody.
Yes.
Thanks for having me on your show.
Thank you. Thank you. So I would like we would like you to introduce yourself to us, please.
Okay, as Bobby has said, I'm Dr. Funmi Sijuwade, and I went to Herobon Girls College, Akure, which is where Bumi knows me from, and then I graduated from University of Lagos, College of Medicine, University of Lagos in the year 2000. So I'm a millennial graduate. I studied dentistry, so I've got a BDS in dentistry, and then I then came to the UK where I did my conversion exams, and then I did my postgraduate studies in cosmetic dentistry. So I have a PG set in cosmetic dentistry. Then I then went to do my MSc in restorative and aesthetic dentistry from University of Manchester. I am a fellow of the College of General Dentistry, United Kingdom. So I practice in Cambridge. I am a general practitioner with special interest in restorative, aesthetic, and cosmetic dentistry.
Wow, wonderful. Thank you very much. Today we are actually going to be encouraging youths who are thinking, I want to do medicine. I like the smiley TV kind of profession, but I don't know how to get into it. So that's why we are here today to talk about how to inspire young ones and even some older ones who think, oh, actually, I could still go into dentistry. So we're going to be learning from you today. So thank you very much for finding time to be here with us. Now, my first question is, what inspired you to become a dentist? And what do you enjoy most about your profession?
Okay, so I grew up in a household where healthcare has been, my dad worked in healthcare for so many years, my uncle. So it kind of like was an unspoken thing that you're wired. That was the way I felt, that I was wired to go into healthcare, whether I liked it or not. But thankfully, I enjoyed science. I loved, you know, science. I couldn't see myself do anything else. I didn't like history and all of those things. I would do the exam and pass them, but I was just more of a science person. Maths was my thing, physics and all of
Mm.
that. So it kind of tallied with my dad's desire of me going into healthcare. And in Nigeria, dentistry was not very popular as such. You didn't find a lot of people going into dentistry. You found more people going into medicine, which was initially my initial kind of mindset as well. And then I got admission into University of Lagos to study dentistry, and I thought, okay, let me see, what that entails. I went into it. I got offer somewhere else to do medicine, but it was in the east, and my dad was like, "You're not going." my dad really wanted me to go to university, to be honest. So when I got that, I got into dentistry. By second year, my dad was like, "Oh, you know, we've got something for you at Ife to study medicine." But by then, I had already gotten into dentistry, and I found out what dentistry is about. And what inspired me, or what made me stay with dentistry, was the fact that I realized that in dentistry is very hands-on. The history of dentistry is actually that um, it was a surgical discipline, like an aspect of surgical discipline. You know, the way you find ophthalmologists are surgical discipline, and dentists. And then something funny enough, someone was telling us the history of that recently, back in, I don't know how many years ago. And then something happened, and then they decided to make dentistry an entity on its own. So basically, dentistry is a hands-on
Mm.
profession, and I am a hands-on person. I do a lot of things. I sew, I bake, I cook, so it was hands-on. So for me, I found that, oh, I could use my hands, I could go into surgical things without, necessarily um, going into surgery in itself, the medicine.
Wow, interesting. Nice to hear your story. Good, good. Thank you. Now, what educational path did you take to become a dentist, and what advice do you have for aspiring dental students? I know you've mentioned a bit of it, your path, but how can you advise those who are aspiring to become dentists, especially? Well, should we say UK, Nigeria? So you've got this broad knowledge and broad experience to tell us, either outside this country or within the country.
Okay, so I did my dentistry in Nigeria, most of it, at least the undergraduate side of it in Nigeria. And so I'm very, very familiar with the pathway, even though things have changed a lot. I mean, we graduated secondary school in 1992, so things have changed. But however, when we graduated, which I think it wouldn't be so different, but you had to do SSC that we did. I don't know what they call it now in Nigeria. But then we did JAMB as well. I think they still have JAMB in Nigeria. And in the SSC, you've got to do physics, chemistry, biology, maths, English, and other disciplines to get you your 9 subjects in SSC. And then in JAMB, you had to do, if you were going to go into dentistry in JAMB, you had to do physics, chemistry, biology, and maths for JAMB. That's the 4 subjects. And then apply to your schools. And then if you get the cutoff mark for the JAMB and all of that, you get in. You've got to have, in my time, it used to be the A1, A2,
A
I think
three, C
A3,
four, C
C4,
four, C5,
and
C
all of
six,
that. So
and
you have to get
C7.
so in your physics, chemistry, biology, maths, English, you have to get a minimum of credit there, or you can get distinction, but nothing less than a credit. If you cannot get pass, if you get a pass, you wouldn't get in. That was Nigeria. In UK, as you know, UK will have the GCSE, and then you have the A level in the UK, and a lot of schools as well. It's similar to medicine in terms of the criteria. So you need to have, I think, an A for your A levels, basically. You need to have a or B's to get in, depending on the university. I don't know, some university will want you to have an AAB and whatever it is.
Yeah, check
So only you
UCAS for
can,
that.
yeah. And also for that, with some universities in dentistry, you have to do physics, you have to do chemistry. For some of them, they will say biology, chemistry, and maths. So for some, biology, chemistry, physics. But majority of them want you to do physics because, believe it or not, it might not seem like this. People always think, oh yeah, dentistry is just teeth. It's more than teeth. And physics is a very, very core part of what we do in dentistry. Chemistry is a very, very core part because we work with a lot of chemicals. and you have to know your chemical equations in dentistry. There's a subject of there's an aspect of dentistry called the science of dental materials. Very, very involved. It's a very deep chemistry, biochemistry thing where you deal with a lot of compounds and things like that to create what we use as dental materials, and your physics as well. The dynamics of some of the things we do in the mouth is very physics based. And of course, you can't play with your biology because that's the human anatomy and all of
Yeah.
that. So you need those to get in. The specifics, you have to find out from what university you want to go into to say what exactly do they want for you to study dentistry.
Wow, thank you, thank you, and leads me to our next one. You were mentioning that you were into, or is it you're into cosmetic dentistry or something like that. You said something about cosmetic. Okay, so my question is, can you describe the different specialties within dentistry and what led you to choose your specific field within the profession? Because it seems there are
Oh,
different aspects to it. So maybe you mention
yeah.
them for novice
Yeah,
like us.
so a lot of people don't know that there are different departments and different specialties in dentistry. I remember the first time I said to someone there are different specialties, and they're like, "What do you mean? Do you mean you specialize in one tooth, one each tooth?" No, that's not how it works. Um, the same way that in medicine you have surgery, we also have surgery in dentistry. We have oral surgery. The same way where in medicine you have medicine, general medicine, we have oral medicine. The same way you have pathology in medicine, you have oral pathology. And then we have restorative dentistry, which can then you can then have a subsection of restorative dentistry as cosmetic dentistry. We have orthodontic dentistry,
Mm.
where like the orthopedic surgeons and things like that, where you have them straightening, the layman's term of orthopedic surgery is that they are putting your bones together, straightening it, and if you've had a fracture, similarly, we straighten it with orthodontic dentistry. So you've got a whole load. Implantology, in dentistry, there's so many aspects. We have pediatric dentistry, where
Yeah,
that deals with children.
that's where my sister just got qualified. Hey, shout out to Bimbo Babatunde, well, former Babatunde, Bimbo Akindele, Dr. Bimbo Akindele from, yeah, she just qualified just in
Fantastic.
November. They did their exams in November. So,
Oh,
yeah, so
fantastic.
thank you.
So yeah, so we have pediatric dentistry. So we've got preventive dentistry, we've got periodontics or periodontology that deals with gum disease. That's a
Yeah.
specialty that deals with gum disease because in the mouth is the mirror of the body. So everything that ailments that can happen in the body, sometimes the mouth is the first place where you get it. Hence we have the oral medicine, where
Mm,
if someone has Crohn's disease, for example, or other gastrointestinal issues, you can actually see it in the mouth. You can actually spot it first in the mouth. Your
mm,
dentist might be the first person to say to you, "Oh, you've got a lot of erosion in your mouth. Do you have reflux? Do you have this?" And then they can say, "Go to your GP and be tested for gastric issues." And that might be the first place where they spot it.
mm,
There are so many signs of of general, if you're anemic, there are things that could show if you've got vitamin B12 deficiencies. There are certain signs that we will see in the mouth that will tell us that you have got it. Diabetes, for example, there are sometimes I have sent my patients to go and have their special tests done to check if they're diabetic. When I look at their mouth and I see
mm,
that they've got a lot of gum disease and all of that, and that's sometimes that's the first time they would ever know. That's the first test they will go and they check, and then they'll tell them, "Oh yeah, you're diabetic," and they didn't realize it until they came to the dentist, and
mm.
they had things like that. So there's a lot that goes on in the mouth. There are specialties that deal with that as well. So your dentistry is not just your teeth, it's your oral health, it's your your throat, your mouth, your things going on in your mouth that can be a reflection of what's going on in your general health.
Wow, it's interesting you mentioned that sometimes the first sign of any internal chronic disease could be from the mouth. Many people shy away from going to the dentist. Well, some maybe due to pain, some just they don't just want to, they can't be bothered, and things that I know children under the age of, is it 16 now? There's this routine check for them every 6 months or so. But with adults, it's only when you have a toothache you just want to go see a dentist. Normally you won't just see why you should see a dentist if you haven't got a toothache, because you guys always bill us, you charge us so much every time, even if it's just to check. So but it's interesting you mentioned that. So actually, for purpose of prevention is better than cure kind of a thing, I think it will be encouraging to ask people to start
Yeah,
visiting the
so Bumi,
dentist.
one of the things that I'm passionate about, which is unfortunate, is what you said about kids go routinely but not adults. That's
Mm,
actually not, that shouldn't be the case. That
mm,
tends to be the case in our demographic, our ethnicity, Black people, Black Africans.
okay.
Your average white British person goes to the dentist regularly every 6 months or however many times. Some people, it's not, 6 months is not prescriptive to everybody. Your dentist needs to check and tell you where you fit. There's something called a recall.
Mm,
So for Mr. A, the recall could be every 3 months, depending on what we see. For Mr.
yeah.
B, it could be 6 months. For Mr. C, it could be 10 months. For somebody else, it could be yearly. But a white British person goes regularly. It's part of their regular thing. Dentistry, unlike maybe medicine where, oh, you wait till you have a headache or you wait till you have a problem before you call your GP. With dentistry, a lot of things that go on and that can go wrong is very silent.
Mm,
You don't feel pain. When you've got caries, like decay in your mouth, you might not feel the pain until it's too late, until
mm,
it's gone into the nerve, and now they're telling you, sorry, you have to take your tooth out or you need root canal treatment. Things like that, you need to go regularly because we spot it by check, without you getting any symptoms. And that's why we encourage regular checkups. And it's only in our demographic, our background, that
yeah.
we don't make that a routine. It's actually the British white people go regularly. Also, there
Mm,
is the issue of oral cancer that can be spotted quickly and easily if you go for your regular checks. Signs of cancer that you don't even know that you have until your dentist checks. Hence, we tend to encourage that regular checks because with
mm,
dentistry, if you catch it early, then you can deal with it
yeah.
basically quicker and without having gone through a lot of issues. You mentioned children. Yes, in the UK on the NHS, dentistry is free for children. You don't have to pay anything.
Yeah.
Up until the age of 18, you can go to a dentist and it's free if you're able to get an NHS dentist in the
Mm,
UK. And then after 18, then you pay for it. But what you pay for it is actually minimal on the NHS, but you still pay something towards it. But on the general outlook, it's our people that don't go. Most,
mm,
yeah, and that's the thing. We don't, because we're not raised that way. We're not brought up. It's like if anything is wrong, if nothing is wrong, you stay at home. Don't wait till you get a toothache before you go and see your dentist.
mm. Okay. A take home message for us all. Don't wait till you get a toothache when it's excruciating. Say, I'm never getting an appointment. I've called them, I've done this, and then some have to go private and all, because there's always a long list, a very long list to, well, that's a longer waiting appointment
Yeah.
to get on to see a dentist, even GP sometimes, except it's an emergency. So anyway, yeah, but we're grateful for the system we have, that we're still able to book all of these things. So don't wait till you have a toothache before you see a dentist, because you could actually get signs of whatever is going on internally from just checking your teeth. Thank you very much for that. Now, what is a typical day like for you as a dentist, and how does your schedule vary? So,
Um,
7 in the morning or 8?
I tend to start at 9. I'm not an early morning person per se,
Okay.
so I start my work at 9. I have worked in practices where I've started at 7:45
Mm,
before in the past. So it depends on the practice and when they open, but I start work at 9 o'clock in the morning, and I step in, and it could be anything. We pre-book, so our patients pre-book, so we have an
yes.
appointment book, and people book, so they have an appointment. So I get in, I already have a day list of patients that I'm seeing, and it could range from just checkups. People just come in, like I said, British people, we have checkups, normal checkups, just routine checkup. They come. It could be treatment. It could be some people might need fillings where they have holes in their teeth. Some people might need crown preparation. It could be extractions. I do quite a wide range of things. Yes, my special interest is cosmetic dentistry. So sometimes people can come. I do things like smile makeover, veneers and things like that. That's the sort of thing. So basically changing people's smile. So I do a lot of, lot of that. But I also, because, my background is general dentistry as well, so I do extractions as well. So my list can have extractions, it can have, yeah, so a wide range of things. And it could be emergency, someone coming in with a toothache. So my day
Mm,
is quite, yeah, I do have an hour's lunch break during the day, in the afternoon, where I take my lunch. But even though sometimes work do extend
escape.
into the lunch break and things like that, at the end of the day, then there's paperwork that I have to do in between, because here in the UK, we need to do a lot of paperwork. We need to write our notes. It has to be, our notes has to be good. We have to report everything the patient comes in with and do a good record. We have to do treatment planning for them and things like that. So, yeah, so that's my day really.
So you finish at 5, or is it 9 to 5 then?
It varies. It varies. Some days I finish at 5, seeing patients. Sometimes it extends to 5:30. Sometimes someone walks in and you've planned, okay, I'm going to spend 40 minutes on this person, and the
And it's
procedure
more
takes
than that.
longer. So you stay. You don't tell them to get out of your seat. You stay and you do it. Sometimes you get an emergency. You don't know what is coming, and it could be 5 minutes thing, or it could be longer. So it depends, but we try as much as possible to keep time and keep schedule. And then when you finish, depending on how busy your day has been, that can
Mm,
dictate how busy your paperwork time after work will be. So your
mm,
paperwork time can then now extend even more. And paperwork time means tidying up the notes you've done during the day that you've quickly, jotted down a few things. Now you want to tidy it up. It can have to do with your writing referrals. If you see someone that needs to be seen at the hospital, then you sit down and do your referrals to the hospital and
mm,
things like that. So it depends on how busy your day and how busy the yeah, so there are days when I've left work at 6 o'clock. There are days when I've left work at 8 o'clock.
wow.
There are days when I've left work a lot earlier. If I had a cancellation at the end of the day, or I have a big cancellation during the day, I move my patients up or whatever. And
Mm.
sometimes it could just be, oh, okay, that patient's cancelled. Okay, I've got, and nobody else is booked. Oh, I can go home early today. Yeah.
So do you work weekends then?
I
Sometimes.
do. I work on Saturdays. Yes, I
Mm.
work on Saturdays. I don't do Sundays. There are some dental practices that open on Sundays, but I don't. But I work on Saturdays.
All right.
Yes, alternate
Okay.
Saturdays. Yeah.
All right. Great. So it means most times, because you're a hands-on person, most times you're on your feet, because most of most of the time when you go into the GP surgeries, they're always on their feet doing one thing. Somebody is saying, "Oh, RA," when they're checking the children's teeth. They're, oh, 1, 2, 3, 4, 5, whatever it is, they're counting things, and and
Yeah.
I try to listen once and think, what are they trying to say? But I guess it's all part of the coding, the coding of your
Yeah,
profession.
your teeth. Yeah, it's the charting of the teeth. But I sit down, I stand. Different people do different things in different postures in dentistry. Most of what we do is done seated actually. So like
Mm,
fillings, you would sit down to do a fillings.
yeah.
What I'm feeling, but I know some people that do stand up to do it, because dentistry really does have an impact on your back because of the posture that we do. We stand, we bending, to see the patient's mouth. So it does do a lot on the back. So for some dentists, they have coined up the posture of standing to do most things because it helps their posture. Some people sit, but most of them were trained to actually sit down to do fillings. I was trained to stand up to do extraction. So you're doing a lot of sit stand depending on what you're doing. And then some people do their checkup standing, like what you have seen when you said they're just counting 1, 2. It's probably during checkups. Some people, I do stand up to do my checkups. Sometimes I sit, but I tend to stand up. But when it comes to fillings, I sit down to do my fillings, stand up to do extra. So there's a lot of standing, sitting, standing, sitting. Yeah.
Okay. Thank you for letting us know that. So to those aspiring to be dentists, you can see it's not just one position. You stand, you sit, you stand and sit. So we're learning. Thank you. What are the key skills and qualities that make a successful dentist?
I think it's the skill that makes you a good whatever profession, any professional would have. But one of the things that I would say is a heart for people, care. You have to be caring to be in dentistry, because it's a profession where nobody wants to come and see you. Nobody wants to come and see a dentist. They don't want to be there because they have heard either they've had bad stories, some people have had bad experiences for whatever reason. There's just this phobia thing for dentists that goes around that people don't want to. So you have to have this sense of compassion for the people you're seeing, to know that they don't want to be there in the first place. So be compassionate and caring. If you show compassion and care, it will make someone that is anxious more relaxed to see you. You have to be patient. I've had my patients tell me over and over again, oh, you're so patient, you're so patient. You have to be patient. You have to be patient to be in dentistry, because you've got people who are really nervous, who don't want to be there. So some of them come in with this some of them come in with a slight out of anxiety, and they're a bit aggressive. They don't want to be there, so you have to convince them. They're coming in seeing you as the enemy, so you have to be patient. You have to listen to them, listen, and then take it gradually. And then we work in a confined space, unlike some other work where people do hands-on, where you're busy working with your hand. Our own space is very small. You're working in somebody's mouth, which is a confined space. So things are very, you have to go gently, slowly but effectively, efficiently. You can't be too slow and you can't rush. So you have to have that balance in life, and you have to be patient. So you have to be caring, you have to be patient, you have to be compassionate. To be a dentist, you have to have integrity as well, because people are trusted. It's about trust. Someone's coming and opening their mouth to you. They don't know what is going on. They can't see what you're doing, so they're trusting you. So you have to have integrity, and you have to be hardworking, because the dentistry is not easy. It's hard work. I'll tell you, it is hard work, because you're balancing a lot of things. You're balancing, like I said, sometimes anxious patients, trust. You're also doing a lot of mental work, because someone is coming to tell you, I've got pain here, I've got this, I've got that. You have to work out what it is. And that takes a lot of, mental work. You have to think, what is it? Okay, this person has said A, B, C. What is it? What do they have? You have to put it all together, take x-rays. I take x-ray here. Which x-ray do I take? Which image? And things like that. So it's very mentally. So you have to, and also you have to be strong. I remember once an older dentist told me years ago. I was like, "Do you go to the gym?" And I was like, not really." He said, "I go to the gym every day after work, because I have to be fit to do this work. I have to be fit." Yeah, it can be draining by the time you're seeing, however many patients you see a day, you see a lot of patients a day and you're doing different things on them, it can be draining.
Yeah, and I think one more thing I would like to add to maybe one of the qualities is someone who is not easily irritated because you see
Yeah,
a lot. And
yeah, that's the patience part of it, isn't it? You have to be patient. You have to
so,
just not get, yeah,
yeah,
irritated. You have to be
yeah.
patient.
So if you've gone past that, you've crossed the Rubicon of being irritated.
Hmm.
If not, don't go there. So for young ones, learn to, yeah. Anyway, so for those listening, thank you very much for still watching, for still staying tuned to a very important topic on dentistry as a career. So now, because we have exhausted 30 minutes of our time, thank you very much for watching, and we hope to bring the next one to you, which is the second part of this interview. Get your questions ready, write in the comments, share, like, and I will see you next time. Bye bye. See you next time for the